Hello all, welcome back to the new video. So in continuation with the previous anatomy series, so here I am back with another video wherein we'll be mainly discussing about the musculocutaneous nerve, which is one of the most important nerves. But you won't be getting any essays on this, but it's a very important for your clinical practice. But before getting into the video, I request everyone to please like, share and subscribe to my YouTube channel since it takes lots of effort to shoot and upload videos like this. So without any further ado, let's get into the video.
Musculocutaneous nerve is the nerve of the anterior aspect of the arm. The root values, the musculocutaneous nerve, it arises from the lateral cord of brachial plexus from the root values, that is C5, C6 and C7 spinal segments. Okay. After it originates, that is from the lateral cord of brachial plexus, it runs laterally. So you can see, right, it is going laterally. It runs laterally downwards and pierces the coracobrachialis muscle and supplies it. It goes laterally and downwards, and here you can see it pierces the coracobrachialis muscle and supplies it, and then it runs downwards and passes between the biceps brachii and the brachialis muscle. So when we consider this to be the both like the biceps and the brachialis muscle, it passes in between like the biceps brachii and the brachialis muscle after piercing the coracobrachialis muscle, and then at the level of cubital fossa. So pierces the deep fascia and runs lateral to the biceps tendon and continues downwards as the lateral cutaneous nerve of forearm. So see in the picture. So after passing in between the biceps brachii muscle and the brachialis muscle, at the level of cubital fossa, it pierces the deep fascia, runs lateral to the biceps tendon. So this is very important. So the nerve which only runs lateral to the biceps tendon is the musculocutaneous nerve. This to be the biceps tendon. This is the medial side and this is the lateral side, right? So the musculocutaneous nerve passes lateral to the biceps tendon and continues downwards as the lateral cutaneous nerve of the forearm. This is important. That's all. So the major relations. So for relations, I've given a simple diagram for you people. The relations anteriorly, the biceps brachii muscle, right? I have told you. So it passes in between the biceps brachii muscle and the brachialis muscle. So anteriorly, what is present? The biceps brachii muscle, and posteriorly the brachialis muscles, which is simple. And then the laterally and the medially. So when we consider the laterally, radial nerve only at the level of above the cubital fossa. So let me refer to the diagram. So this is the musculocutaneous nerve, which is the blue colored one. So for at the level, like when it passes in between the biceps brachii and the brachialis muscle, there is the radial nerve, like you'll be discussing in the future classes. So the radial nerve is present laterally to the musculocutaneous nerve only at the level above the cubital fossa, which you can see in the diagram. So this is the cubital fossa, right? So at the level above the cubital fossa, the radial nerve runs lateral. Medially, I've told you one is the biceps tendon. So if the nerve is present laterally, then obviously the medial side is the biceps tendon at the level of cubital fossa. Then the two major, like the major things, which is the median nerve, ulnar nerve, and the brachial artery, which are all the contents of the cubital fossa. So from let me discuss from the diagram. This is the ulnar nerve. This is the ulnar nerve, and this is the brachial artery, and this is the musculocutaneous nerve. Now, the major part, the supply, the motor supply, and the branches. So I've already told you the musculocutaneous nerve is the major nerve of the anterior aspect of the arm. So what are all the motor supply it gives? It gives motor supply to all the muscles of the anterior compartment of arm, which is the biceps brachii, brachialis muscle, and the coracobrachialis muscle. And then the articular branch to the elbow joint, which is nerve, it gives an articular branch to the shoulder joint. So it is present near to the shoulder joint. Whereas the bicep, like the musculocutaneous nerve, it is present nearer to the elbow joint. So it gives an articular branch to the elbow joint. So the motor supply, coracobrachialis, biceps brachii, and brachialis muscle, and an articular branch to the elbow joint. Next, the cutaneous branch, I've already told one cutaneous branch, which is the lateral cutaneous nerve of the forearm. So it supplies the lateral and the anterior aspect of the forearm. which you can easily remember from the arm. So applied anatomy is not very much important for musculocutaneous nerve, but just remember ki injury of the musculocutaneous nerve is very rare. If it damaged, and definitely, which are all the muscles that going to waste, the muscles that are present in the anterior aspect of the arm, which is the biceps brachii and all. So what are all the major functions of the muscles of the anterior aspect of the arm? They aid in flexion of the elbow joint, like they are the major flexors. So if the musculocutaneous nerve is damaged, then there is definitely the loss of the strong flexion of the elbow joint, and additionally, biceps muscle also aids in the supination of the elbow joint when the elbow is mid flexed. So loss of supination as well. And then there is loss of biceps reflex. So these you will be coming across the reflexes in physiology. So what we'll be doing is we'll be taking an hammer and we'll be hitting on the biceps tendon so that the action is seen is the flexion of the forearm or the elbow joint. So there is loss of the biceps reflex, which is one of the deep reflexes. And then there is loss of sensation in the lateral aspect of forearm. Obviously, the major cutaneous branch of the musculocutaneous nerve is the lateral cutaneous branch of the forearm. So there obviously there will be a loss of sensation in the lateral aspect of the forearm. So these are all the major points that you'll have to remember.
So that's all for the video. In the next upcoming classes, I'll be mainly teaching you about the radial, ulnar and the median nerve, which are one of the most important nerves and essays. And after that, I'm planning to take thorax, which is I'll be mainly taking about the coronary arteries and all. So stay tuned for the next one. Until then, this is me, Manadeep, signing off for now. Thank you.